Hello students, today we are going to revise the topic adjustment disorder. Myself Jamika. Let me give you an overview of adjustment disorder. So adjustment disorder are a stress related condition. Your experience more stress than would normally be expected in response to a stressful or unexpected event, and the stress cause significant problem in your relationship at workplace or at school. Workplace problems, going away to school, and illness, death of a close family member or any member of life changes can cause a stress. So most of the time people adjust to such changes within a few months, but if you have an adjustment disorder, you continue to have emotional or behavioral reaction that can contribute to feeling anxious and depressed. So this was about the overview of adjustment disorder, and you don't have to tough it out on your own, though. Treatment can be brief and it's like to help you and regain your emotional footing. Let's start with slides. Introduction. Adjustment disorders are conceived of as developing in response to a variety of casual stressful events, the symptoms representing an adaptation to this stressor or the other continuing effects, as I told you in overview, that any stressful conditions can cause adjustment disorder. Why? Because you are not able to cope up with the situation. Adjustment disorder, a maladaptive reaction to an identifiable psychosocial stressor that occurs within 3 months after onset of the stressor. Right? So the individual shows impairment in social and occupational functioning that are in excess of an expectable reaction to the stressor. Means if you are not, we all have the problem in particular situation, we are not able to adjust, but if this problem is for 3 months or more than 3 months, then you need to consult a doctor. You might be having an adjustment disorder. Prevalence. Prevalence in a study conducted in US, 10% had adjustment disorder, and male to female ratio is 1:2. Outcome of depression, international network study found a prevalence of only 1% in adjustment disorder in 5 European countries. Studies have also found a higher rate of adjustment disorder among persons exhibiting suicidal behavior, mainly adolescents and young adults. Adjustment disorder has been reported to be almost 3 times as a common major depression. Studies of soldiers psychiatrically evacuated from Iraq over a 3-year period found that adjustment disorder was the most common diagnosis made in 40% of evacuation. Now here are types of adjustment disorder. So adjustment disorder with depressed mood, adjustment disorder with anxiety, adjustment disorder with mixed anxiety and depressed mood, adjustment disorder with disturbance of conduct, adjustment disorder with mixed disturbance of emotions and conduct, and adjustment disorder unspecified. Etiological factor. So, adjustment disorders are caused by significant changes or stressor in our life, right? So, genetic, your life experience and your temperament may increase your likelihood of developing an adjustment disorder. Like here we have shown in the diagram that stressor, how you're interacting with particular situation, an individual, how stressor and an individual interacting with each other, that leads or that causes to adjustment disorder. That's through family member or friends, relationship issues or divorce, major life changes, illness or health issues, moving to a new house or a place, sudden disaster, money troubles or fear. Causes in children and teenagers, family fights or problems in school, anxiety over sexuality. So these are the problems or these are the causes that you can find in children and teenagers. Psychodynamic theory and biological theories. So these are the causes of adjustment disorder. Now, with causes, let me tell you the risk factors. So some things may make you more likely to have an adjustment disorder, that you are at higher risk of adjustment disorder. So stressful life events, right? Both positive and negative may put you at risk of developing an adjustment disorders. Like example, we can take divorce or marital problem, then relationship or interpersonal problem, changes in situations such as retirement, having a baby or going away to school, then adverse situations such as losing a job, loss of loved one or having financial issues, problem in school or at work, as I told you earlier, life-threatening experiences such as physical assault, combat or natural disaster or ongoing stressors such as having medical illness or having a crime-ridden neighborhood. And what are the life experiences that can cause or that can put you at higher risk? Our life experience can impact how you cope with stress. Like for example, your risk of developing an adjustment disorder may be increased if you experience significant stress in childhood, have other mental health problems, or have a number of difficult life circumstances happening at the same time. So this was about the risk factor. Now let's see the symptoms. What are the symptoms present? So symptoms depends on the type of adjustment disorder and can vary from person to person, right? Your experience more stress than would normally be expected in response to a stressful event, and the stress causes significant problem in your life. So adjustment disorder affects how you feel and think about yourself and the world, and may also affect your actions or behaviors, right? So some examples we can take: acting rebellious or impulsive behavior, acting anxious, withdrawn attitude, feeling sad and hopeless, suicidal thoughts, loss of self-esteem, then frequently crying, feeling sad, not enjoying things you used to enjoy, worrying or feeling anxious, nervous and stressed out. You may stop taking food, so lack of appetite, difficulty in concentrating, feeling overwhelmed, difficulty in functioning in daily activity, withdrawing from social support, suicidal thoughts or behavior, or avoiding important things such as going to work or paying a bill. So the symptoms of an adjustment disorder starts within 3 months of a stressful event and last no longer than 6 months after the end of stressful event. However, like persistent or chronic adjustment disorder can continue for more than 6 months, especially if the stressor is ongoing, such as unemployment, right? So when you feel that you need to visit a doctor, right? After all the symptoms, if you see that you have all the symptoms, so usually stressors are temporary and we learn to cope with them over a time, right? Symptoms of adjustment disorders gets better because the stress has ended, but sometimes the stressful events remains a part of life, or a new stressful situation come up and you face some emotional struggle all over. So by the time you need to talk to your doctor, if you continue to struggle or if you're having trouble getting through each day, you can get treatment to help your cope with better with stressful events and feel better about life. Diagnostic criteria. So according to DSM-5, the development of emotional or behavioral symptoms in response to an identifiable stressor occurring within 3 months of the onset of the stressor. Number 2 is the symptoms or behaviors are clinically significant as evidenced by one or both of the following. Number 1, under that, marked distress that is out of proportion to the severity or intensity of the stressor, taking into account the external context and the cultural factor that might influence symptom severity and presentation. Significant impairment in social, occupational, or other important areas of functioning. Number 3 is stress-related disturbances does not meet the criteria for another mental disorder and is not merely an exacerbation of pre-existing mental disorder. Number 4 is the symptoms do not represent normal bereavement. And number 5 is once the stressor or its consequences has terminated, the symptoms do not persist for more than an additional 6 months. So what are the treatments are available for adjustment disorder are psychotherapy, crisis intervention, family and group therapy, support groups, cognitive behavior therapy, interpersonal psychotherapy, medications to reduce the anxiety. Anti-anxiety drugs can be given, benzodiazepine, non-benzodiazepines, SSRI and SNRI, which are antidepressant drugs. So here we have reached to a conclusion. Developing a strong network of people to support living a helpful life and establish a good self-esteem for us. So this was all about adjustment disorder. Hope you all understood. Thank you.